teen suicide is rising at an alarming rate, not only in the United States, but right here at home. Tonight, learn what to look for in a struggling teen and find out about a wonderful new program that's available right here in the Northland. This is an important episode of Speak Your Mind. Next. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. Suicide in teens is a tragedy that, of course, we'd love to eliminate, and a fantastic new program that's available right here in our region first is a step in that direction. Now, if you're a regular viewer of our show, you know we depend on your questions, so it's your turn to do your job. Call the numbers on your screen right now. Locally dial 218-788-2844 or call toll-free at 1-877-307-8762. And you can also text us your questions or email them using the number or address listed at the bottom of your screen. And we'll be answering your questions in the second half of our show. But first, I want you to meet Megan Condit, a public health educator with Carleton County Public Health and Human Services, who serves as the regional coordinator for the Text for Life Suicide Prevention Grant. Eli Lee is a senior attending East High School who plans on majoring in finance in college, and Emily Warpala is a senior at Cromwell Wright High School attending UMD right now, who plans on majoring in social work in college. Both Eli and Emily are student volunteers at their schools for the Text for Life program. Thanks to all of you for coming here. I'm so excited to have you here because for the last few months, everywhere I go, I see posters about Text for Life. I see them at the courthouse. I see them at my work. People aren't too surprised about that, but I see them in my dry cleaners too. So that is how prevalent they are. And people have been asking me, well, tell me about this Text for Life program. What's that all about? And so I said, tune in Thursday night, and Megan's going to tell you what it's all about. So Megan, what is this Text for Life program?
Well, thanks for having us. And the Text for Life program is kind of three-pronged. It has the text service that we set up, which is a texting service for our target audience is 7 through 12, so mostly students to text into if they're feeling suicidal, if they are going through something really tough that they need to talk to somebody for. They can text LIFE into the 6-digit number, and they can be connected with a counselor who's able to help them through that. And then the second piece is training, so we want to make sure that the community is there trained, knowing how to prevent suicide, knowing suicide intervention, and being equipped with those skills. So that's the second piece of our grant. And then the third piece is marketing. So we want to make sure that we're getting the word out there that this resource is available to students, to young adults, kind of anyone who is in need of it. So some of our marketing materials, like you've talked about, the posters that we have are up around schools and the community and everywhere, so people can see that and have access to those.
And I love those posters because I think it's a really great way. The more that people see the posters, the more that they start getting this idea in their head that this is a program that you can use and access, and that people aren't only hearing about the program through their school only, but that you can see this up all over the place, and maybe even having other people having conversations with the teens they know about that. So Eli, tell me what your role in the Text for Life program is in the school. What do the student volunteers do?
Well, I help get together a group in my high school, and basically what we do is we market it a lot. We wear these T-shirts around. We put up about 30 posters throughout the school. When Megan came and spoke at our school last spring, we handed out bracelets to everybody in the school, so everybody knows that it's out there, and that if they need someone to talk to, all the kids who wear these Text for Life shirts are a part of the Text for Life group, and are QPR trained just in case a student wants to talk to another student if they're in a crisis of their own. So that's basically what our job is a lot of marketing for the
Okay, Emily, people aren't going to know, a lot of people out there are not going to know what QPR is, so tell us what QPR stands for.
Megan, could you?
Yeah, it stands for Question, Persuade, Refer, and it's kind of the CPR of suicide prevention. And we had a student training this last spring, and some of the schools were able to come and some weren't able to come. So Emily's been a great, she wasn't able to come to that training with her school, but she's been great in her school spreading the word and stuff.
And so I didn't mean to put you on the spot right there, but I bet you will never forget what QPR stands for now. This is the way to do this. But are you doing some of the similar things that Eli mentioned in your school?
I actually went to a QPR training now I'm reminded, a couple years ago. And we were going to try start something in our school because we'd had something happen, but nothing really took off from the ground. There are students that we can talk to, and Megan has come in and talked to our school before about the Text for Life program, and there's posters all over. So.
And tell me what you know, Emily, just in terms of from your school about how students are responding to the notion of Text for Life.
I think people know about it, and it's a good thing. Like, I had a friend one night was really having a hard time, and I'm like, you can call this line, or if you don't want to talk to someone on the phone, you can just text them. And the next morning she came to me and she was like, thank you for that last night, and it was really cool.
So it actually works.
Yeah.
Yeah, and you have living proof that it actually works.
Yes.
Tell us a little bit more, Megan. You mentioned, I love that, what you said, QPR is the CPR of mental health. And so with the question, persuade, and refer, I think some parents would have some questions about then, are the high school students acting as counselors? And what would you say to those parents?
Yeah, that's a great question. QPR is kind of a layperson training for anyone who is interested in helping. QPR is a very basic kind of intervention where you learn how to question someone about suicide, persuade them to get help, and then refer them to the appropriate resources. So it's not necessarily sitting down and doing counseling and walking through that with somebody, but it's making sure that that person goes to get help and that you know where to bring them to get them the appropriate help.
And what was your interest in becoming involved in this program, Eli?
Well, I think it's been needed for a long time at our school, something like this, not even the whole texting, but just a suicide prevention group. And I've seen kids struggling at our school, and I just want them to make sure that there's someone there for them if they need help. And that's a part of what our group is all about. Like between our entire group, at least one of the kids in the school will be able to somehow relate to a kid who's in the group. So we have kids from the student government, student council, all sorts of things, and video game clubs, and just a really wide range. So I just want to make sure everybody feels welcome and has someone to talk to.
I love that idea that it's not just made up of the usual people who you might see on student council or at East Association or any kind of group like that, that the aim is to get people from many different groups across high school. And I'm assuming that it operates in your school as well, Emily.
Yeah, we just accepted Rachel's challenge, so we've kind of started a group with that, and just seeing the positive posters all over the school is kind of cool when you go there and you see people put in posters that say High Five Friday or just smile at someone. It can make their day, and it really does change things.
And in your school, what do you want and how do you expect that things will continue, because you're a senior and this is the first year of the program, and then you're out of there. And so how will this continue at your school, Emily?
I really seen it make a positive change. People kind of realized what other people are going through and have become more aware of the situation. And so I think people are going to start talking to each other more and, just know who to go to.
And the aim then would be to start breaking that taboo that exists about you can't talk about things like this, right?
Yeah, and it's interesting when you liken it to, asthma. Mental health and suicide is just like asthma. It's a physical disease, just like asthma is, only affecting a different organ, not the lungs, it's the brain. And so once we kind of get that into people's heads and they know and understand what it's all about, that's really going to help things move forward.
Now, if there's a student out there who's listening to this show and they want to become a part of Text for Life in your school, Eli, what would they do?
Just see one of us with the shirts on, and or to the advisor of the group, and just talk to us, and we'll be happy to have you join our group. Always looking for new people to join. So.
And if there's a school out there that is listening that doesn't have this and wants this is part of their school, how do they get involved?
They can give me a call. We've been in touch with most of the schools around the region, and they've been great and excited about having us, and so I'm always available.
And we will have her contact information on my blog, so you're going to have to read my blog. I think that we've got some great guests here, but we're going to say goodbye to these guests. We're going to take a quick break. This is snack time for you, and we'll be right back to answer your questions after this short break. Thank you so much. Welcome back as we continue our conversations. We have two guests with more information on the effort to reduce teen suicide. And one of the things that you will have noticed is that there was the number on the screen during the break of the number that you can text. And I just want to point out that that number spells out text me. So if the number's too hard to remember and you didn't get that into your phone yet, you can use text me. Now, our next two guests, Dave Lee is the Director of Carleton County Public Health and Human Services, who together with other regional professionals work to secure the funding for the Text for Life program. And Tracy Chur works as the text coordinator with HSI Crisis Connection, where she's responsible for developing and implementing the Text for Life program. Thanks to both of you for being here this evening. And Tracy, you win the award on this show for the longest travel to get here. She came all the way from the cities just to be with us to give us information about this great program. And Dave, I want to start with you. What was the impetus for getting the grant funding for the Text for Life program?
We know suicide has been a major issue, not only in Carleton County, but the region. And even though we had many interventions that we'd attempted, both through education and referrals and so on, we were not making the needed impact with adolescents in our region. So we knew we had to find a way to reach kids where they were when they were in crisis. And they were more in electronic media, not in our traditional service areas.
And Tracy, I have a question right here. A young man from Duluth says, and this is the kind of thing I think that the kind also part of the Text for Life program. I think my friend is suicidal. Should I confront her?
Well, I think having that conversation and asking if the person is suicidal, saying this is what I notice and this is what I'm concerned about, I think that's an okay thing to do, and let your friend know that you're concerned about them, and then maybe give her the text number, and we can kind of take it from there and we can talk with them.
And we even heard from Emily earlier in the show when she was talking to a friend of hers who was distressed, and she said, here's this number, and later on that friend did text that number. And so people don't always do it maybe right at that moment, but even later on when they have that available to them. Now tell us, what has the response been so far to the Text for Life program?
It has been overwhelming. It's great. The kids use it. We see roughly between 300 to 350 texts a month from kids. So we're really getting the use out of it, and the kids are really engaging with it.
And so that's a high number.
Mm-hmm.
And are those all people calling in saying that they're suicidal, or what are we seeing with that, Dave?
Well, there's not only suicidal kids, but actually there are kids that have a lot of issues that may lead eventually to a suicidal ideation. kids that have relationship issues, breaking up with their boyfriend, girlfriend, issues within their family. Sometimes there's even abuse, neglect kinds of things that have been going on. So it's actually might be pre-suicidal, but heading in that direction. And so there's a whole variety of issues. Mental health issues in general are also a primary concern.
And actually, we know that for kids, you know, although adults may think that breaking up with a boyfriend or a girlfriend is not that big of a deal, it's something that you recover from. If this is your first boyfriend or girlfriend and you're going through this, your very first breakup, that's a pretty big deal for you. And we can see then how that can prompt how kids, teenagers can feel overwhelmed by that.
Yes.
And is that what your text responders are seeing as well?
Yeah, we do see a lot of relational issues, and sometimes it is with, you know, breaking up with a boyfriend or girlfriend, and it feels like it's the end of the world, and there's nothing left to live for. And sometimes it's relational issues with maybe a parent or a sibling or something that we can help them talk through and get to the other side of, so it doesn't feel so hard.
We have another question here, Dave, a woman from Rice Lake Township, which before I asked this question, we were talking, I was talking with my producer before the show, and he said, well, do you have to be in Minnesota or be from Minnesota to use the text service? And I said, oh, yeah, well, if you're in Superior, can you use the text service?
Well, the target area, the grant-funded area, is the 7 northeast counties of Minnesota. The number works outside of that area. So those callers are not turned away. Or those texters are not turned away.
So you people in Rice Lake Township, just put that under your hat. But this woman is asking, does asking a teen about suicide put the idea in their head?
No, and I think that's a real misconception. And actually, that's one of the reasons we want to get out to the schools and we want to get the information out to kids, get the number in their phones. It actually has a preventative effect. And the more kids talk about it, can understand it, can also talk with each other and trusted adults, it actually lowers the chance of suicide if the issue gets out on the table and can be dealt with.
What I would want to know if I was a parent, Tracy, is I would want to know about the text responders and the kind of training that they have. And are they actually trained therapists or are they volunteers?
I have a staff of counselors that are, so a few of my counselors are social workers, a few of my counselors are, I have a school counselor that's on staff as well, but then we have interns that also answer the texts as well, so they're from in a master's level program, counseling program from a few of the schools in the area near us.
And so you have people who come in maybe with a higher level of experience and knowledge, but then they also get specific training.
Yes, we have a 50-hour training that all of our volunteers and interns go through when they come into our call center to volunteer with us.
And so if a teenager has texted in and the text responder, Dave, feels that there is some concern for the teenager, what is the next step that text responder takes? Because that would be my other question as a parent is how do you move from texting to if it's a texting situation that reveals there could be a safety issue, how do you move to securing the safety then?
Tracy's staff, at the crisis center have experienced both. It also answers the 800 number, so they're experienced in moving kids and dealing with emergency situations and would follow the same protocols. And one of the things that we hope to do is move kids from the texting line and eventually have them seek out help either in their school, their community, or other mental health professionals or whatever would be appropriate. But there is experienced, they have protocols in place for responding to kids in that level of crisis.
So parents should feel comfortable and confident that the text responders can know when they need to access that and will do that and do what they can to keep their kids safe.
Absolutely.
Here's a question from a man in Hibbing. Are teens afraid to get help for fear of being labeled as suicidal? Tracy?
Well, I think sometimes that stigma does inhibit kids from reaching out and asking for help, which is why I really think that the text program is is helping with some of that, because that's where they can first practice this conversation. They can practice it with us over text, and we can talk about it, and then we can encourage them to talk to somebody face to face, a counselor or a school counselor or a parent.
And what do we know, or do we know anything yet, Dave, about that conversion rate of the texters who maybe it's believed kind of need then to move to a calling, to move to maybe seeing somebody? What's that conversion success rate been, or do we not have information yet on that?
We don't. There's a lot of referrals that go on. It's fairly early in the grant, we are tracking and doing the best we can. But this is a student-driven, it's a kid-driven process, and we want to make it very easy for them to access help through texting, and also the next step, make it as easy as possible, remove as many barriers as possible, so kids can feel free to move on and be able to pursue a referral if need be. But we are tracking that, and we hope to have more data on that in the near future.
Now, on a practical level, for example, if we take Duluth as an example, because I know Duluth well, but I also know that Carleton County has a SLIMS program, a School Link Mental Health Services. We have therapists that are school-based therapists, and so it is one of the things a teenager might do in their school then is walk the kid down to that person, saying, here is somebody who you can talk to.
Yes, and I think there's a number of areas where kids could get assistance. School Link mental health folks would be one area. There are trained traditional social workers, counselors, psychologists within the school. But also, as part of the presentations that Megan talked about, kids are identifying other trusted adults in the school that kids feel very comfortable approaching. Training those folks so that it makes it easier to approach also. And eventually, we'd like to use some telemental health systems to be able to hook kids up with therapists in the community.
Explain telemental health and how that works, because not all of the viewing audience then would. I don't know if you would be the one to answer that, Dave, or Tracy.
Dave,
more and more, based on the shortage of mental health professionals in the area, and also the large distances we cover in the 7-county Arrowhead, we're basically what it is. It's high quality Skype. The kids would understand that, but it's also HIPAA compliant, which means it's encrypted and it's secure. And kids are much more comfortable talking in a Skype type conversation than maybe going to a therapist's office many times. So we want to make it very easy for kids to access help, via that media.
And I love that as an idea too, especially for places that are more rural and don't necessarily, where access is more difficult. That just takes away the geography barrier. It takes away the access barrier, and makes help accessible to people who need it, not just to people who can get there. Then I think one of the things that we do need to do is talk a little bit. This isn't exactly Text for Life, but it's on the topic of suicide. If you're a parent and when do you need to be concerned about what's the difference between your teenager who maybe isn't talking to you a lot and they're going through a bad time versus they need a little bit more attention, and the parent should be concerned that there may be something going on?
Well, I think if they're seeing signs like the kids saying, I just don't want to be here anymore, I don't want to do this anymore, ask those questions. What do you mean about you don't want to be here anymore? Because I think the kids are really thriving for somebody to notice that they're feeling suicidal. So if they're feeling down, they're not talking, they're withdrawing from their friends, they're withdrawing from some of their school things that they'd done at school. If they're withdrawing from that, have that conversation. I think it's worth it. It's worth to have it.
We have another call here. A woman from Grand Portage. If someone is suicidal and it's a sexual orientation issues, what are the resources available? And I think this just brings up, before we even talk about that, let's talk about kind of what are some of the high risk factors, certainly for teens, but obviously this could be for an adult as well.
Well, there are certain populations in which historically there's been larger, higher rates of suicide. One of the focuses of our grant and the service in general is, GLBT kids have had to go far and wide to find support and to connect with other kids, or trusted adults. And so that is an area that we're focusing in on, and we're building in resources both in schools and in the Northeast, but also Tracy's staff are well equipped to be able to make referrals and when those issues come up.
So we know that the GLBT population, the gay, lesbian, bisexual, transgender population is high risk. Other high risk teen populations.
Well, I think some of the kids that may experience bullying, they would be at a higher risk. Some of the minority groups would be a little bit higher risk, but you know, I think one of the good things about the Text for Life program is we can't kind of see, we don't have a bias when somebody texts into us, so we take them for what they say and what they say is going on for them.
And maybe that even serves as a factor where I would want to text in, because I feel a little bit more assured that I won't be judged. I won't be judged on my appearance. I won't be. You won't make assumptions about my appearance.
Exactly.
And when we think about teenagers and how central appearance and fitting in can be to their lives, you know, just even sitting here, I just get more and more excited about the Text for Life program as I listen to all 5 of our guests this evening talk about this program. And we are out of time again. I can't believe it. I just got the 1-minute sign from Joe, and this was like a lightning round show. Thanks to our wonderful guests for being here, and thanks to all of you for being here. I think the take-home message certainly is that we want everybody to feel that they have access to help, and now we know that teens, we have this wonderful new program here in the Northland where teens can have access to help through the Text for Life program. Text the number or text to text me. Don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links and read my blog, the place where I answer more of your questions. And you can also email us your questions about next week's show, when we'll be talking about resilience. It's Mental Health Boot Camp, and we've got personal trainers for your mind. I kind of wish they were here this week, but they're not. I'm Dr. Carolyn Phelps. Join us next week. Thanks again for watching, and good night.
We have a quick promo that we could do
Yep.
first.